Wait. Okay. You're on.
Hey guys, my name is Emily. I'm from Augusta University Health, and thank you so much for joining us for our first ever Facebook Live event. And today we're with our own Dr. Rawson. We're going to be talking about social media and healthcare. And Dr. Rawson is our chairman of the Department of Radiology and Imaging. And he was also named to the HIT 100 list by Healthcare IT News. He recently presented the Facebook effect on radiology at the Radiological Society of North America meeting in Chicago. And today we're going to talk with Dr. Rawson about his thoughts on social media and the impact that it has on empowering our patients and the healthcare industry. And just so you guys know, this is not an FAQ session today, but we would love to hear from you, so please feel free to leave your comments below. And we're going to start off. Dr. Rawson, I know that you're also the president of the Georgia Radiological Society, so why don't you just tell us a little bit more about yourself and then your role here at Augusta University Health.
Thank you. My name is Jim Rawson. I'm the Warren Professor at the Medical College of Georgia in the Department of Radiology and Imaging. I'm a radiology faculty member, and I do body imaging, which means I image the chest, abdomen, and pelvis. I've been here for over 20 years, and it's my privilege to be the chair of the radiology department here. I look forward to our discussion today about social media.
It's great. Awesome. We're excited. So first off, we want to know what attracted you to social media, both as a professional and as a medical professional.
Well, it's an interesting story. I think like most people, I was encouraged to sign up for a Twitter account at a national meeting. And many of us had that experience, but it often came with the encouragement, but not with the training. So I was actually at a national radiology meeting, set up a Twitter account, and didn't know how to use it. So you could guess I didn't have a very good experience because I wasn't following anyone, no one was following me, I didn't understand how it worked, and when nothing happened, I just ignored the account for quite a while. I was then at a health policy meeting. I was at the Academy Health meeting, their annual research meeting, and they had people literally in the hallway saying, please follow the meeting hashtag on Twitter, and they would help you set up an account. And in a few minutes in a hallway, they showed me how to find the hashtag, how to follow the meeting. So when I sat down in a session, I was actually able to scroll through on my phone the different tweets about the meeting. And what struck me was some of them were about the topic that was being discussed in the lecture I was in, but a lot of them were actually tweets from all the other rooms that I wasn't in. So I was getting to see the whole conference on Twitter from one room. And that kind of hooked me into wanting to see how I could use social media.
That's awesome. So that was the turning point. So when you talk about knowing who to follow or what to follow, how did you discover that? What are some of the role models or folks that you regularly check in on or that you follow?
So a lot of what I do is I follow communities. So I use hashtags, and a hashtag is just the number sign followed by a series of letters or numbers. And that's usually an abbreviation for a group of people who have a common interest or similar hobbies, similar perspectives. Right. And so some of the hashtags that I follow have been HCLDR, which is the Healthcare Leadership Group. And they have a tweet chat on Tuesday evenings at 8:30, and if you participate in that chat, you get to interact with the other people on the chat. And if you find what they're saying interesting and they find what you're saying interesting, you may meet people and follow each other from that. But the healthcare leadership community is a really good community within Twitter that actually is focused on a variety of topics within healthcare and within leadership.
Awesome. So you see that healthcare community is very strong there, that you were able to buy into and find other folks to engage with.
Yes.
That's awesome. So I have to know, what is your favorite thing about social media, just in general?
I think it's the community, being part of a virtual community. Wherever you live in the world, you live in a geographic community. But on social media, you can be part of a virtual community that doesn't really have geographic constraints. So there are some groups that I have interacted with and been part of that are global communities that are looking at improving healthcare or looking at other aspects of leadership. And that is very intriguing to have access to a global community regardless of where you live. And many of those people ultimately become friends or colleagues in projects.
That's awesome. Really broadens your horizons and your perceptions. That's great. So I know we mentioned that you got named to the HIT 100 list. So what is that? What is HIT?
The HIT 100 is actually listed as crowdsourced each year in July. And the way that has worked is Michael Planchard, actually known as the EHR guy on Twitter, crowdsources out to the social media community people to be nominated to the HIT 100 list. And it's not really about the rankings as much as building the community and getting to meet people and interact with people. And so through that process each year, there are some folks that I have not interacted with on Twitter but have met through that process, and others who I have interacted with for years that I will again see and interact in that process in the summer. So it's a neat crowdsourcing activity, but it's much more social and interactive and really just fun.
That's cool. That's great. So let's talk about how you currently see social media impacting healthcare. I mean, social media is everywhere. We see it in so many different industries, but really, how does it specifically impact healthcare, do you think?
I think one of the ways that social media impacts healthcare is through access to information. And access to information could be research that is tweeted out, because in a tweet you can have an embedded link to a website or to a paper. But it also can be the communities that you can access, whether they're patient communities or healthcare communities, to be in a discussion and interact with them.
That's great. So how can patients actually use social media, you think, to leverage their healthcare?
One of the best examples is actually a chat that's the BCSM chat. It's a breast cancer social media chat. And this group's existed for several years and actually has patients, physicians, other healthcare providers, and has usually focused discussions around questions about breast cancer. And it's a virtual community around the topic of breast cancer. And that allows for interaction with people who have a similar disease or have had similar experiences or who might already have gone through or experienced things that you're about to. So it's a very powerful tool to connect people.
So seeking out that support that they might need if something comes up, folks with the same condition, and just kind of learning more and gaining that knowledge from others who've experienced the same thing.
Yes.
That's great. So I know that you have a lot of peers out there that are probably very wary or dismissive of social media and healthcare, and I know you mentioned that, you know, when you first got into it, you were just kind of said, do this, and I think a lot of folks and your peers, other physicians, are kind of said, you know, social media, it's the it thing, do it, but aren't really told how. What would you tell those folks that don't think it's a big deal, that think it's going nowhere? I mean, what would you want to tell them?
Well, I think that social media is a tool. And like any other tool, there are a lot of different things you can do with that tool. There are certainly people who've either gotten themselves in trouble or made a nuisance of themselves on social media. But there are other people who've used social media to interact with people or to learn about topics. So if you looked at a hashtag that was breast cancer, or you looked at a hashtag that was related to a particular complaint or problem, you would see the discussion that's occurring about that problem. And that's informative. Since our patients are actually already on social media, our patients actually already are having discussions on social media, and it's helpful to understand what their concerns are and what their questions are as a physician, as a healthcare provider. You don't have to be on Twitter or any other social media feed where you are pushing content out. You actually can observe, you can have minimal interactions, or you can get very engaged with specific people or specific communities. There's a wide variety of ways you can use social media.
I think, like you said, getting involved on Twitter from your perspective and getting to engage with other professionals is really a learning experience, that you can take away information and other perspectives.
I found it interesting how often I'm able to say, I actually first ran across this on Twitter, or I first learned about this through social media. I think it is an opportunity to learn. It's an opportunity to get access to information or perspectives that you might otherwise never have seen.
That's awesome. I know we also talked about you recently speaking at the Radiological Society of North America meeting to talk about the Facebook effect on radiology, and you talked about how digital health, connected care, social media will impact you and patients, your specialty. Could you emphasize that a little more or talk a little bit about what that means, how the meeting went?
So for me, it was a very interesting discussion because we had multiple presenters looking at social media from different perspectives, and the program itself was actually live cast, and it was also being tweeted. So there was a big screen that had the live tweets coming across, and because it was on a Tuesday evening, I missed the healthcare leadership chat. So I let my friends in the chat know that I wouldn't be able to attend. But while they were having the chat, they were also able to follow us live. And their tweets about what we were saying were showing up on the big screen while we were having our program. So we were in Chicago giving a talk that was live, but interacting with people who were actually in another tweet chat. And to me, that was the best example of just how interconnected all of this can be.
Right. So is there anything in particular that you took away that you learned from that particular conference?
I think what struck me from the social media perspective is both how connected people are and what additional opportunities there are to connect to other people. Whether it be patient groups or health systems, there's a great opportunity for us to connect using social media with people that we might not work with every day.
Great. So, is there anything else that you want to add from the social media perspective, the importance of social media, other ways that you see social media maybe advancing healthcare or what's on the horizon?
Yeah, I think one of the advantages that social media gives us is it's an opportunity to tap into information sources and information flow that we might not usually see. So if you were interested in health policy, or if you were interested in a particular disease or health system, following hashtags or following individual Twitter accounts allows you to build a data stream that is available to you. And that lets you connect with information that you might not otherwise see, but it also allows you to interact with people that you, again, might not work with every day.
Right.
Or might not even be in the same country with, or the same time zone. So to me, one of the really unique advantages is this asynchronous nature of communication. You can tweet a question, you can tweet a comment or a web link to an article,
Right.
and you may then go to sleep or you may go to work, and hours later you may check Twitter and find that someone has commented on that, and you've had a chance then to interact with them, or they may in turn have asked a question that someone else has joined in, or you may all actually be communicating at the same time and having a discussion online on a mobile device using just a shared social media platform.
Right.
And I think the opportunity to have those types of discussions and to be engaged with people is really a very powerful aspect of social media.
That's awesome. Well, I did want to ask you too, and this is kind of putting you on the spot, but I know you said that sometimes you would say, well, I first saw this on Twitter, and you never thought you would say that. Is there anything in particular? Are there times that you interact with other professionals or learn something new and you bring it back here to Augusta University Health, or you've used it in your practices?
So a number of journals actually tweet links to their articles when they come out. And since the journal articles are often published online before the paper copies are printed and mailed, There are times when I've actually gotten or seen a tweet that says, this is the #1 article in our journal this year, or I've seen an article that's released on something that I'm interested in. There are a number of healthcare groups and agencies that actually publish web links to all of their reports. So before they're printed, there are web links to the Institute of Medicine reports. There are web links to a variety of sources of information that might eventually come to me, but it's coming out in real time. Medicare, CMS, actually has a Twitter account, and they publish or tweet out links to their documents as they become available.
Wow.
So that is as real time as you can get.
Yeah. So I would say, your peers or other physicians, they're getting that information more quickly. They're able to take that back and provide better care for their patients, right? That's awesome. So is there anything else that you want to talk with our audience about today, or anything else that you want to add?
Yeah, I think the important thing, if you're not on social media and you're considering getting on social media, the important thing to consider is, where do you start? And unlike when I started, there are now dozens, if not hundreds, of how to set up a Twitter account or how to use Twitter on the web. So finding a brief video that shows you how to set up an account, or how to use hashtags, or how to follow people is much easier. And even if all you do is, when you set your account up, choose people or information you're interested in, you'll have a reasonably good experience in terms of having a feed of information coming to you. But at the same time, if you can identify communities that have similar interests,
Right.
using the hashtags to be able to find similar communities, I think that's what makes it a rich experience. And even if all you do is read the material and watch the material, that actually is part of being social media, part of being engaged.
You've gone dark, folks. Give us just a second. There we are. Okay, so I have one final question, and we call Dr. Rawson around here. He's our bow tie guy, and this is just off the cuff, but we have to know, how do you pick out your bow tie every day?
That's good.
Or how many bow ties do you actually have? Do you know?
I don't. Not one of the things I count and keep track of.
Okay. No bow tie inventory here, so we were all wondering. Okay, so we are going to wrap this up, and we just want to thank Dr. Rawson for talking with us today about social media and healthcare. I want to thank you guys for joining us, and we hope that this is the first of many Facebook Live events, so be on the lookout for upcoming events. And we are tuning out, so have a great day on behalf of everybody here at Augusta University Health.
Thank you.